Assalamualaikum and a very good morning to my beloved audience. I'm Maisara Subhatina Muhammad Fuzi from PHM 2453 A1 going to talk about my persuasive speech entitled Microdosing and In-Vitro, a step to combat animal extinction. Without further ado, let's get started. Each year, an estimated 192.1 million animals are used for science across the globe, as stated in an article published in 2022 titled Animals Used in Research Overview provided by the MSPCA Angle Association. At some point in our lives, we have adopted an animal or can think of someone close to us with an animals we care about. How would you feel if your pet bunny or even your childhood puppy was forced to consume a lethal substance till death or have their body dissected without any anesthetic or prior euthanasia? Today, I will reveal many problems associated with animal testing and the importance of switching the alternative methods for a more promising future in cosmetic and medicine. I will begin by providing information about the animal testing itself. Numerous animals have died in laboratories. They have been tortured and experienced unbearable aches and pains throughout their lives. These include nearly 80 million experiments on animals as well as millions of other animals who are killed for their tissue, used to be bred genetically modified animal strain and bred but not used. Research had been done by People for the Ethical Treatment of Animals, PETA, state each year more than 110 million animals, including mice, rats, frogs, and many more, are killed in United States laboratories for biology lesson, medical training, and experimentation of chemicals such as food, drugs, and cosmetics. Before their death, some are forced to inhale toxic fume, some have holes drilled into their skull, and others have their skin burned off or their spinal cord crushed. In addition to the torment of the actual experiments, animals in laboratories are deprived of everything that is naturally and important to them. Do you know where your taxpayer money goes? In the past year alone, the National Institute of Health (NIH) used $19.6 billion to fund cruel and useless experiments on animals. This mind-boggling amount comes directly from your pocket. No matter how you fill out a tax form, your hard-earned dollars help pay for experimenters to torment and kill millions of mice, monkeys, and other animals. What do taxes pay for? Your taxes support a broken system. 95% of all new drugs that are shown to be safe and effective in animals fail or cause harm in human clinical trials. Because different species react differently to drugs and disease, the result of experiments on mice, rats, and other animals can't be applied to humans, and 90% of basic research, most of which involve animals, never result in any treatment or cure for humans. Now, I have told you regarding the animal testing effect. I will share the potential deeper action that can be taken to replace them. In an interview named Alternative to Experimenting on Animals with Dr. Charu Chandrasekera, made public in June 2022 by the Animal Justice Academy on YouTube, Dr. Charu of the Canadian Centre for Alternative to Animals Method, CCAAM, offers two main categories of animal-free method. She oversees first-hand in vitro and microdosing. The first type she described is in-vitro testing. A Greek term translates as glass and refers to examining tissue in petri dish. She regularly used in vitro testing technique in her lab, such as 3D bioprinted tissue models and perhaps most intriguingly organ on a chip that incorporates human cells grown in cutting-edge technology. The chip successfully imitates human psychology, illnesses, and drug responses more closely than crude animal trials do. A variety of cell-based tests and tissue models can be used to assess the safety of drug, chemical, cosmetic, and consumer product. For example, Mertech Life Science Epidermis tissue model is a three-dimensional human cell-derived model that can be used to replace rabbit in painful prologue experiments that have traditionally been used to evaluate chemicals for the ability to corrode or irritate the skin. She identifies the second form in the interview as microdosing. Microdosing can provide vital information on the safety of an experimental drug and how it is metabolized in humans prior to large-scale human trials. Volunteers are given an extremely small one-time drug dose, and sophisticated imaging techniques are used to monitor how the drug behaves in human body. Microdosing can replace certain tests on animals and help screen out drug compounds that won't work in humans so that they are never tested in animals. Seeing as I have presented several options that can be used to replace animal testing, it is eye-opening to hear about the way each of us are impacted in these alternatives are not used in the lab. Many reasons why people microdose involve some aspects of mental health, such as reducing stress and anxiety or alleviating symptoms of depression. In a study in psychopharmacology, researchers asked people their reasoning for microdosing. 21% of people respond that they primarily use microdosing as a therapy for depression, while 7% use microdosing for symptoms of anxiety, and about 9% of people who respond use microdosing to help with other mental health disorders. Overall, 44% of people who respond perceive that their mental health was much better because microdosing. On a brighter note, in vitro testing methods can provide valuable data on the safety of cosmetic products as well as support product claims in areas such as anti-aging and skin hydration. In most cases, in vitro tests provide important information that helps manufacturers select active ingredients and develop their cosmetic formulas. Some of the advantages of in vitro testing including speed. In vitro testing methods that are used reconstitute human cells or skin can provide the necessary information in days or weeks. By comparison, animal testing can take months. Other than that, accuracy. Animal test results may not always be directly applicable to humans. Indeed, the most accurate way to test products intended for use on human skin is to test them on human skin. As you can easily see, I have told you about the limitation of animal testing and given various non-animal approaches to counteract these obstacles. We will not be able to advance towards the undoubtedly bright future that replacement technique will bring us if we keep harming animals for human gain. As human beings, we consumers, animal owners, and have the power to change the unacceptable way we treat our planet. Every poke, abuse, and kill animal we take advantage of every second animal test occurs. As we speak, an innocent animal is either burned alive, cut open, or murdered without mercy. I think that's all from me. Thank you for listening.